You may remember when you were younger having your spine checked for scoliosis. While most of us pass the back check, it's estimated that 1 in every 1,000 children, 20 to 30, will develop spinal curves that are considered large enough to need treatment, and about 2 to 3% of those people in the United States have scoliosis. So, what should parents look for, and what are the new treatments available? Joining us this morning is Dr. Marc Moramarco. He is an expert in scoliosis management and head of the Moramarco Chiropractic and Scoliosis 3DC in Woburn. And Dr. Moramarco, we appreciate coming in this morning.
Thank you for having
me. We all hear
me.
Scoliosis. Everybody hears it and they kind of go, but before we get into the specifics, what is scoliosis itself?
Well, scoliosis is a three-dimensional spinal condition, meaning it's a plastic spine. If we look at the spine from the front, it should be very straight. However, with scoliosis, the spine laterally bends to the side, it rotates or twists. Now there are ribs that are attached here, so the rib cage also rotates, and the spine may move forward and backward. So when you look at it from the side, it may be very straight, or you may have an excessive curve from the back. Also, I should mention that scoliosis typically has no known cause.
Okay. If it goes untreated, if someone has scoliosis and they don't bother having it addressed, what are the long-term effects?
Well, if it gets into the moderate stage or severe stage, it can actually create pulmonary problems, yes.
So it can affect other parts of your health and physical well-being. All right, let's talk about signs of scoliosis now, because a lot of parents hear about it and they get the kids checked and they may see something that looks abnormal. Maybe their kid's a little slouched or something.
Right.
What things should parents be looking for then?
Well, I think we have a photo of this. We have, if you look, you see shoulder unleveling, hip unleveling. One hip may stick out more than the other. Shoulder blade may stick out, and possibly a head tilt. Mm-hmm. Also, rib prominence. Now, I think we have a photo of the rib prominence. Forward bending test. When you were in middle school, you may remember having a scoliosis screening. Mm-hmm. I don't know if you remember that.
I do remember that,
okay.
Yes.
You would bend forward.
It was a long time ago, but I do remember.
You would bend forward, and if one side of your back was higher than the other, there was a possibility you may have scoliosis.
Is there an age here that's usually earmarked for scoliosis? It's more common?
Typically during adolescence, ages 10 through 14. However, it can affect infants, juveniles, and adults.
And so adults can have it as well. So this is something that even though if you're a kid and you don't have it, it's something that you can develop as you get older.
Yes. Okay. And typically it's because it was undetected as a child.
Now, you became involved in scoliosis. You had kind of a personal tie to this in a way.
That's right, because of my daughter. And we wanted to avoid surgery, so we actually found a clinic in Germany and learned a technique over there. She avoided surgery, and I was so impressed with the results. I went to Germany, got certified, and brought it to the United States.
Now, what do those techniques entail that you learned in Germany, and how does it differ from what the normal treatment would be?
Well, it's called the Schroth Method. It's an intensive three-dimensional approach or exercise and breathing technique. It's been used extensively in Germany since the 1920s. It's a scoliosis-specific back school. First, we provide the patient with a spinal anatomy lesson so that they understand their curves, which way the vertebrae rotate, which way they laterally bend. And once we're confident that they understand that, then we instruct them in proper body mechanics, how to sit, how to stand, how to sideline. Once we're confident that they understand that, then we teach them various exercises, such as, the exercises are to achieve a three-dimensional spinal correction via unilateral rotational breathing to derotate the vertebra and the ribs and place the spine into a corrected position.
And you've had very good success with this.
Yes, but the important part is here, once they're in that corrected position, they need to strengthen the muscles that support the spine in the newly formed posture. And we strive for balance and spinal stability. And our goals are simply to reduce or halt the progression of the curve, increase chest expansion, increase pulmonary function, improve posture, improve cosmetic appearance. I like to say we give the patient the ability to control their scoliosis rather than have their scoliosis control them. And we know teenagers certainly like to be in control.
I do know someone who emailed me who was a patient of yours, knew you were going to be on and raved about the success
great.
you've had.
That's great.
To reach Dr. Moramarco, you can visit scoliosis3dc.com. And also, they're going to be having a Healthy Living Magazine Expo this Sunday at the Stevens Estate in North Andover. You can learn more there as well. My Healthy Living Mag for more info as far as that is concerned for the Healthy Living Magazine Expo. Again, that's coming up on Sunday. Dr. Moramarco, we appreciate coming in and continued success with the approach that you're taking here.